From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
It's 8 minutes now before 12 noon. We'll step away for just a bit. When we return, news from Medicine's Cutting Edge. 7 minutes now before 11 o'clock. We're talking about a cancer success story in this country. Cervical cancer in the U.S. accounts for only about 1% of all cancer deaths. It is much more deadly in developing countries, making it, in fact, the second most common cancer among women around the globe. Dr. Gupta joins us this morning with more on cervical cancer screening and maybe what has been done in that area and how we can sort of extrapolate it out a little bit to other kinds of cancer. It's always great to see you. Thanks for joining us right now.
Thank you.
No question that cervical cancer, which is a scourge in the rest of the world, is considerably less of a problem in the United States. Why is that beyond just the widespread use of Pap screens?
Well, I think Pap screening we've been doing for about 40 years now on a regular, routine basis for most women across the country. And the guidelines have recently changed, as you may be aware. But most women do, for some reason, get their Pap smears done. And I think the one advantage cervical cancer has over other malignancies is there's several pre-malignant, early changes that you can start seeing with cervical cancer. So early detection actually makes a significant difference here.
There are two messages that you can apply to other things. One is regular checkups and care. If a woman goes to an obstetrician gynecologist regularly, you can spot these precancerous changes very often. If you have regular Pap smears, you can also have a much better chance of finding this disease in its earliest and most treatable stages. If we did the same thing with a lot of other kinds of cancer rates would drop, I think, probably dramatically in this country.
Yeah, well, correct, yeah. If we did more regular, routine, preventive medicine type of things, you would find less cancer.
We usually wait until something's wrong to go to the doctor, I guess is my point here, instead of being sort of proactive.
Right. Unfortunately, the most common kinds of malignancies don't have those sort of pre-malignant changes going on like cervical cancer does.
You don't know that you have pancreatic cancer very often until you have an advanced case of pancreatic cancer.
Right. So the American College of Obstetrics and Gynecology recently changed their screening recommendations. As you may know, before we were recommending annual or every other year screening starting at the age of 18. They've now recently changed it to starting at the age of 21 and every other year up until the age of 30, and then every 3 years after that. So it's going to be interesting to see what happens to cervical cancer incidences as we've expanded the screening intervals.
And because, of course, everything now has sort of that financial part of the equation as well. The concern is that we'll be doing less of this sort of proactive medicine now and more of the treating of whatever the more immediate situation is.
Yeah, and of course the other big issue that's arisen with cervical cancer is the vaccines. So, vaccination for cervical cancer worldwide is a significant improvement. I think time will tell how much of an improvement it is in this country since we do routine screening, but worldwide it is a significant, hopefully will be a significant impact on this horrendous disease for some women in third world countries.
Yeah, in too many places around the globe. Yeah. Raddocs.com, a really good website for more information. Dr. Gupta, thank you so much for joining us.
Thank you.
It's always a
Happy
pleasure
New Year.
to see you. Happy New Year to you as well. We'll step aside for just a bit. At the top of the 11 o'clock hour, back with more news. We invite you to join us.